Have you ever started a run or a tennis match or maybe a game of pickleball and felt this tightness or pulling sensation in the back of your calf or maybe in your lower leg back into the back of your heel? Maybe it's sharp, stinging. It feels like a stiff 2x4 rather than a mobile ankle that's fluid. Maybe you have some sharp shooting pain there. Well, that's not something that you should ignore. I'm Dr. James Repko from Bayshore Podiatry Center. I'm a board certified podiatrist here in Tampa, and we're talking about one of the most common things that we see and one of the most frustrating that we see in our active patients. And it's from an overuse injury called Achilles tendonitis, which is really a bit of a wastebasket term that encompasses a number of things that can go wrong with your Achilles tendon. So what is your Achilles tendon? Well, your Achilles tendon is the largest tendon in your body. It connects your calf muscle from two different muscles in your calf, your soleus and your gastrocnemius, and it attaches to your heel bone. It handles a ton of load. It is like a large shock absorber or a shock on your car. So whether you're walking, running, jumping, sprinting, cutting, you're using this tendon. You need this tendon. It's exquisitely important. So when it gets overloaded or overused, it either hurts or leads to thickening, irritation, inflammation. Sometimes it doesn't hurt and there's thickening there as well. So what is the Achilles tendon? Well, it's the largest tendon in your body. It is formed by two muscles in your calf, your gastrocnemius and your soleus. They actually twist 180 degrees on their way down to your heel. So they control plantar flexion or pushing down. They help push you off for propulsion, for sudden movements like jumping, lunging, cutting, even lateral movements. But they also control motion in the frontal plane. So they allow for pronation and supination of your heel as well. This tendon is exquisitely important. It is a primary shock absorber for your body. And when it gets overloaded, either suddenly or over time, it becomes inflamed, irritated, it can become thickened, or, God forbid, it can even rupture. I'm sure that people are familiar with professional athletes and seeing that happen. A common complaint whenever it ruptures is actually somebody will be walking or running and they'll feel a pop and fall over and look behind them. They feel like somebody kicked them or hit them in the back of the leg with a baseball bat or a 2x4 and nobody's there. So where do these things come from? Where do Achilles tendon injuries happen? Typically, it's overuse. It's overuse of the tissue, that you're using it too much. You're requiring too much of it for what the strength and resiliency of the tendon or the calf muscle actually is. It can also happen whenever your ankle or your Achilles tendon is too tight. You don't have good mobility through your ankle. It can happen whenever you have a sudden spike in your activity level, if you are doing too much too fast. Some of you eager weekend warriors, I'm guilty of it myself. You get into something and you just want to keep doing it, and you do it as much as you can. And here's the problem that we all make, or the mistake that we all make, right? We're not made of rubber and magic anymore. We're not 18, 20 years old, 16 years old, where we can just push and push and push our bodies without consequences. We're not healing